This segment of DelmarvaLife is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
In today's fast-paced and often unpredictable world, mental health support has never been more important or more in demand. And for so many people, obstacles like cost, distance, and stigma still stand in their way of getting the help they really need. What they might not know about are the benefits of open access therapy and telehealth services. And here with us today to explain is Beth Ann Dorman. She is the CEO of For All Seasons Behavioral Health and Rape Crisis Center. Beth, welcome to DelmarvaLife.
Thanks so much.
I want to talk about, what happens when somebody walks through your doors for the first time.
Sure, yeah. So about 2 years ago, we started a new process called open access. And it used to be that you would call our office like you do many mental health agencies. You would give your name, you would get on a wait list. And we just recognized that people were not getting services in time. And so rather than hearing, we're going to put your name on a wait list and we'll get back to you, folks now walk in our office or telehealth into the office 5 days a week, and they have an hour where they get all of their paperwork completed and then their mental health assessment follows. And it's really about getting folks in the door and getting them the services they need in real time.
That is amazing. So the process is, the first time you're there might be a little long, but then subsequently without the paperwork?
Absolutely, yeah. So we all have to get the information, and we take all insurances. We take private insurance, we take Medicaid, we take Medicare. We also see folks regardless of their ability to pay. So there might be somebody who's listening and thinking, I'm in between insurance or I'm not carrying insurance at all right now. We can also help. And the beauty of the agency is that we have 7 offices across the 5 counties of the Mid-Shore. But with our telehealth program, we're serving the entire state of Maryland. And that is something that is extremely valuable, because it doesn't matter if you live in Salisbury or if you live in Crisfield or if you live in Baltimore, you can still have access to those services 5 days a week.
Do you find that there are people who are more comfortable with the telehealth services?
Yeah, I think it's really it's a choice. It's a it's really personal preference, and so we're able to cater to both those who want to be in person and those who might need a little bit more flexibility. For working parents or folks who are working full time, it might be easier to just hop into your car and sit in your car during your lunch break. As long as you're in the state of Maryland and you have access to a FaceTime, whether it's on your phone or whether it's at a computer, we can help folks right there with their therapy session, and that's all electronic, so you don't have to do the drive and worry about missing time from work or school.
But For All Seasons is growing.
Absolutely.
And you have more locations?
So we have always had our locations in the 5 counties. What we've been doing over these last about 12 months is doing something called Bringing Mental Health to Main Street. And so we are relocating all of our already established offices onto the main streets of all of our counties. And so our Cambridge location has gone from 3 offices, now moving in downtown at 429 Race Street above Craig's Pharmacy, and we have 10 offices. And we're also bringing the open access walk-in services to Cambridge. And so it's really about keeping our already established services, but expanding and meeting the growing need within the communities that we're serving.
Well, that's wonderful, the convenience to get the services and the therapy that people need. But what if just the therapy itself is something somebody's dreading? What would you say to them?
Yeah, I always say it's important to have a place where we can just have a spot to dump our stuff. And it's really about meeting you where you are. There's not someone walking through that door greeting you and saying, this is what it's going to look like. You're going to help that therapist create your treatment plan. And really, I say to folks all the time, you're not signing up for life. You might just be signing up for the next 6 months because there's something happening in your world where you need to sort of figure out how to put one foot in front of the other. We see everything from grief and anxiety, depression, chronic mental illness, transition for families, and we serve children, adolescents, adults, and elderly. So everyone can receive services, and really the therapist is there to meet you where you are and simply just come in and have a conversation in a space where there's no judgment. We meet you in a place of what do you need and how can we help? And if for some reason there's a need for medication, then we refer you right to our psychiatry team. We have 6 members on our team who also see adults, adolescents, and children. And so it's really a one-stop shop to take care of your needs.
That's so important. Thank you, Beth Ann Dorman, For All Seasons.